Diabetes Connections is brought to you by inhaled insulin, glucose management in the moment, by Dexcom, take control of your diabetes and live life to the fullest with Dexcom, and by Mom's Night Out. Treat yourself to some time away with other moms who get it.
This is Diabetes Connections with Stacey Sims.
This week, after a year of deliberations, the US FDA approves the newest product from Dexcom, the G7. A lot has changed in the market and for consumers since the company's last big product approval, the G6, 4 years ago.
Also, the awareness and utilization of CGM around the globe has increased so much since 2018 when we launched G6. So we do anticipate that the rollout of G7 will be dramatically, quite a bit faster than G6. I mean, G6, 3 years after the initial launch, we were still launching new countries with it.
That's Dexcom's Chief Operating Officer, Jake Leach. We do a lightning round of questions to learn more about what was and was not approved here. It's not exactly what's already on the market in Europe. And we look ahead to what is next for Dexcom. Yes, already. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. Always so glad to have you here. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. If you are new, my son Benny was diagnosed 16 years ago this month with type 1 right before he turned 2. My husband lives with type 2 diabetes. I do not have diabetes, but I have a background in broadcasting. I worked in radio and television news, and that is how you get the podcast. Very excited to announce my new book, Still the World's Worst Diabetes Mom, has been met with some really nice reviews. Thank you so much for that. And we are setting up the 2023 book tour. I'm hesitating here because my book tour for the first book, The World's Worst Diabetes Mom, kicked off in 2020, and we all know how that went. So fingers crossed that it'll be easier. I'll get to more places next year. But I want to let you know that if you're interested in buying either book, use the code HOLIDAY, and you can save $3 off both books at diabetes-connections.com. Just click on the shop tab there. We do have a bunch of free stuff in that shop, including my travel guide, which has a printable packing list. So as you're getting ready to travel for the holidays or anywhere, I hope that is helpful to you. Again, that's all at diabetes-connections.com. Use the code HOLIDAY to save. You can also get both books at Amazon. There's a Kindle version as well for both, or wherever you buy books online. All right, let us talk about G7. This was approved last week, if you are listening as we are live here, and it is expected to start shipping in the first quarter of 2023. I have done several interviews about the G7 in the last couple of years. I feel like we've been talking about it since the G6 was released in early 2018. For this interview, I really tried to focus on questions I still had after our previous interviews and other news reports. If you are not familiar with the G7, here are a couple of features that it has that make it different from the G6. It is 60% smaller. It is all in one, which means the transmitter and sensor are now together. It has a 30-minute sensor warm-up. That is the fastest of any CGM on the market. It has a 12-hour grace period. We will go over exactly what that means. The app is completely redesigned. It has a redesigned and optional receiver that's a lot smaller. It is indicated for wear on the back of the arm for ages 2 and up. That is certainly new. And it has what they call improved alert setting for enhanced discretion. And we will talk about exactly what that means and why here in the US, we didn't get that same feature in the same way as they did in Europe. So I'm going to link up all that information in detail on the G7, as well as our previous interviews with the folks at Dexcom. I have talked to the CEO, I've talked to the top designer of this system, and of course, Jake Leach, who was the CTO, the Chief Technical Officer, until earlier this year, and he is now the Chief Operating Officer, and he is my guest this week. Of course, my usual disclaimer, Dexcom is a longtime sponsor of the show, but they don't tell me what to ask or what to say outside of the commercial you're going to hear later on. They are a sponsor because we use and love the product. My son has worn a Dexcom since 2013, but that doesn't mean I don't have questions or even criticism. Okay, Jake Leach in just a moment. But first, Diabetes Connections is brought to you by Afrezza. And when it comes right down to it, there hasn't been a lot of innovation for insulin. There are different brands, but there's really nothing unique when it comes to insulin delivery except for Afrezza. Afrezza is unique because it is the only ultra-rapid-acting inhaled insulin available. It starts working quickly without the need for injections at mealtime. Once you breathe Afrezza into your lungs using the inhaler, insulin appears in your bloodstream in less than 1 minute, and it may start reducing blood sugar in about 12 minutes. Find out more and see if Afrezza is right for you. Go to diabetes-connections.com and click on the Afrezza logo. Afrezza can cause serious side effects, including sudden lung problems and low potassium, and is not for patients with chronic lung disease, such as asthma or COPD, or for patients allergic to insulin. Tell your doctor if you've ever smoked, ever had kidney or liver problems, a history of lung cancer, or if you are pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace long-acting insulin with Afrezza. Afrezza is not for use to treat diabetic ketoacidosis. Please see full prescribing information, including boxed warning, medication guide, and instructions for use on afrezza.com/safety. Jake Leach, Chief Operating Officer of Dexcom. Thank you so much for joining me. And I appreciate you being here so soon after the G7 approval. Thanks for jumping on.
Absolute pleasure to be here, Stacey.
All right. We have talked over the years quite a bit. You were previously the Chief Technical Officer. You've been with Dexcom pretty much since the beginning. Am I right on that?
Just about, yeah. I joined about 18 years ago. So the company had been around for about 4 years before I joined, but we hadn't developed a product yet. We're still doing a lot of research at the time that I joined, and it was a very small team, very focused on building Dexcom's first continuous glucose monitor.
Well, at some point when we have time, I'd love to circle back and talk more about what that journey has been like, because my son was diagnosed 16 years ago this month, and we were hearing whispers of this CGM thing, which, there was something out there, but it wasn't quite close to what it is today. So we were saying off the air, I'll be honest with you, I feel like we have talked about the G7 so much over the last couple of years that I'm not even sure where to start here. Congratulations on the approval, of course. We're very excited. All my listeners want to know, how soon can they get this? But let me start by asking, was there anything surprising in this approval? Was anything taken out or added in? You and I last talked in May, just for context. Anything that's changed since then?
Yeah, I think the number one thing, we got the product CE marked earlier this year and launched in Europe and a few other countries. And with the US approval, one of the big changes between G6 and G7, other than all the G7 features we've talked about, is that it's now actually the first and only iCGM that's trusted for use in pregnancy. So we used to have there used to be a warning in the labeling around use in pregnancy, and so now with G7. It's trusted for that use, which is great. It allows G7 to be used in a ton of different use cases with, type 1 diabetes, type 2, or even gestational. So that was great. We did one other difference between the product with G6 or with, the European product was we had a silence all feature that we have removed just for a short period of time here for the approval. And then we're going to move back and bring that feature back here very quickly, working closely with the FDA. That's the G7, you could still silence your alerts and alarms, but there was an extra feature that we plan to implement soon, which will allow you to silence them for longer periods of time when, it's more convenient. The user's knowledgeable that their glucose is, either too high or too low, and basically saying, I know I've got this, don't alert me for a little while.
I'm going to get back to that, but I don't want to lose the pregnancy question too. Did something change in the technology of the G7, or was it just more study? Why did that approval get through, you think?
It's a great question. There's two components to it. One is that G7 is indicated for use in the arm. So the insertion sites are in the back of the arm. And so that was a big component to pregnancy. I was ensuring that we could use arm wear. So that was part of the FDA's kind of perspective on it. The other one was there's been quite a bit of clinical work done, both by Dexcom and others in the pregnancy space. So the performance of the product is no different in pregnancy than it is in non-pregnant people. So it's basically that the FDA is now comfortable based on the G7 performance.
I'm going to have people screaming at me to move on from this topic, but I have to ask. There's something, I've been pregnant twice. I get your abdomen area changes, but your abdomen doesn't really change. Was it a question of insertion on the abdomen that people were concerned about pregnancy?
It was, the perspective was kind of insertion in the abdomen and even the potential performance in the abdomen wear site for pregnancy. There's been some studies have suggested that there could be some issues with that. So the arm wear is kind of just really helped get through that, as well as some of the clinical data.
All right, I'm going to do a whole episode on CGM and pregnancy coming up. That's a fascinating.
Oh, absolutely. It's a
question.
if you think about the way that gestational diabetes is both diagnosed and treated, CGM can play a really big part in improving that for mothers.
You mentioned the Silence All. Our friend Nerdabetic has done a bunch of videos on YouTube about the G7. And he said one of his favorite features, I think, was this Silence All alarm. This is what you're talking about, that in the US, we're going to get G7, but we can't use that right away.
Yeah, it's not in the initial product, although we're working closely with the FDA to bring it back into the product. It was a feature that was highly requested by users because basically, you can acknowledge the alerts and silence them for a period of time with G6 and with G7, but sometimes you want to be able to silence it for longer than the current, G6 allows. So we built this feature in, and it's selectable by the user, and they can decide how long. It's even up to 6 hours actually is how long they can silence it for if they want to. And so that's basically what we've implemented in the product for Europe. And then we've got it ready for the US and working with the FDA to get it back into the product quickly.
Just practically speaking, to make sure I'm understanding this correctly, let's say a 17-year-old theoretically would eat a large carb-heavy meal and forget to bolus, and then would realize, oh, I didn't, would give himself insulin, and then would say, you know what, I know I'm going to be high. I'm going to silence this alarm for 2 hours. Is that kind of a practical application of that kind of silencing?
It's a great example, Stacey. You know that your glucose is high. You know it's going to be high for a while. You don't want to keep getting reminded, and you don't want to necessarily turn your high alert off,
right?
Because you may forget to turn it back on. Same with the low, right? And so that's what it's really about. It's about providing the user with discretion and choice. And so that's why that feature is important, and we want to bring it to the US as fast as possible.
Right. Flip side of that, I got a question from a listener, pardon me while I look at my phone here, is about silencing alarm controls and not have them silence music, podcasts. Their current ability to override anything else is super frustrating. Is that something in the G7?
So it's basically unique to the app. There are things that people do when they're trying to silence their Dexcom alert and they start silencing all kinds of other stuff. People turn off Bluetooth. There's a lot of things you can do. So the way the Silence All feature works is it's just applicable to the Dexcom alerts. And as soon as the time period expires for which you have it silenced, it will automatically, your alert will return to its normal settings in terms of
I'm sorry,
sound.
I think I may have read that question wrong. I think what he's referring to is when you get an alert now on the G6, it comes through and interrupts your podcast or your music, and you have to physically clear it. Which is inconvenient while you're driving and that kind of thing. I think that's what he was referring to. That's not going to
Got it. Okay. That's still the same. You still have to clear the alerts because we have to ensure you actually got it. And we're going to keep alerting you until we know you heard your alert.
Okay. You mentioned arms. I feel like I need a confetti cannon over here. We are now cleared for arm use, which everybody was doing anyway. Anything else in that? Were there other areas? I mean, alternate sites can mean a lot of things to a lot of people. Anything to know about that?
No, it's basically when we get the site indications, it's because that's where we ran our clinical studies. That's where we focused to show the iCGM level performance in the clinical studies for the adults and the pediatrics. We ran sensors in the arms. And then for the pediatrics, we also have the upper buttock location as well.
You and I had talked in the past. I guess before I move on, I guess my question was it tested and is it cleared for anywhere else in the body? In other words, it is not cleared for the previous indications. Is there any additional body part other than arms?
Just for pediatrics, the other cleared location is the upper buttocks. But for the abdomen, it's in the US, that's not an indicated site for G7. We really focused on the arm. We did study it in the abdomen, and we studied in the performance, while good, the arm performance is better. So that's why we picked the arm location.
Interesting.
There's some publications that we've done on all those clinical studies and the detailed data, and it shows that very good performance in the abdomen, but the arm performance is even better.
I feel like we're going to have the opposite problem. And I don't know, I shouldn't say this to the official Dexcom folks here, but you know what I mean. For years and years, we've all been asked, oh, can I put it in my kid's arm because it's not approved for that? And now new people are going to be like, can I put it in my kid's stomach? It's not approved for that. It's one of these situations where explaining that that's where you tested it, there's certainly nothing dangerous or anything else like that. I don't know if I can even ask you to go on the record with something like this, but people are going to put it wherever they want, right?
Yes, users have choice and do what they want.
All right, good. Well said. I got a question about the grace period. We've talked about this before. So one of my listeners, Mike, said, can I achieve no CGM downtime as well as skip the first 7.5 hours of the sensor where he feels like it's settling in, it's a little jumpy, by inserting the G7 at the beginning of the current G7's 8-hour grace period? So this person would have two sites overlapping for a while, which some people have called soaking. I'm curious what your take on that is.
Yeah, users can do that if they want. One of the big differences between G6 and G7 is the moment you insert the G7 sensor, the sensor session, as it used to be called, automatically starts. So there's no starting the session with needing to connect to the mobile phone or the receiver or the insulin pump and hitting start. The sensor automatically starts. So that clock of 10.5 days, 10 days plus the 12-hour grace period, starts the moment you insert the sensor. So you can wear two at the same time, and you can finish up a sensor session, and then you pair to the new sensor. The devices, whether it's a receiver or a mobile app, it won't talk to two G7s at the same time, but the G7's up and running the second you deploy it. So as soon as you want to pair to it, it will transfer over the data that it has.
I'm curious. I've heard a lot of chatter about how people are wanting to use this new grace period. My feeling as a mom is that people will use it as a 10.5-day sensor. They'll wait to the last minute like they always do, for the most part, the majority. I'm curious if you've seen that in the European users. Do you have any data on how people are using the grace period?
The data that I do have is that most users are using it for more than 10 days. There's some that do turn off right around the time that the sensor says, okay, it's time to replace it. But we're not seeing that everybody runs it out to the end of 10.5 days, although you can. It's really more around that extra 12 hours to find a convenient time to replace your sensor. Yeah. So you're not planning your whole day around that when the 10 hours pops up and you have to replace your sensor.
Yeah, no, I think it's brilliant. I know, a lot of people have really been excited about it. All right, some nitty gritty stuff before I move on to some big picture. The overlay that Dexcom is sending out, again, I haven't seen this yet. I've only seen what folks in Europe have shared. It looks like it's white. And a couple of people asked me to ask you if you are thinking about making clear. Yeah. And if not, if you might be thinking about making different skin tones.
We're looking at a couple of different adhesives. So the one that comes out, that it basically is in every, so the overlay is now included with every sensor, where with G6, sometimes you have to call in to get extras. So it comes with every sensor. The one today that comes with it is this white, really kind of new, fantastic adhesive that we found that does a really good job of keeping the edges adhered for those folks that have sensors that don't stick always as well. And so, but we are looking at other ones, including clear. We're not anticipating doing the different skin tones because of just the complexity of that, but definitely opaque. One that it has, it's not completely clear, but it's not white. It's for us, it's mostly around, the most important thing is the performance of the adhesive from both, comfort and also durability. And then, the color is also, it's an important aspect. So there's that. And there's also all of the great folks out around the community that have come up with other bandages and overlays and things to keep the sensors on that can be really helpful as well.
How has the adhesive been received in the countries that have had it?
Good. It's been great, actually. We've been seeing less skin irritation with G7. There's, in a couple of our limited launch cohorts, we had folks that actually had stopped using CGM because of skin irritation. So it was a small group. And so these folks were some of the first to come on and try G7. And we saw a lower rate of skin reactions in that group compared to what they were experiencing with G6 or with competition's products. So we're excited about that kind of early signal that it matches also what we've seen in our clinical studies with the new G7 is a new adhesive. We did expect, we designed it specifically to have less irritation, but still stay adhered well.
All right. It's interesting because and I'm going to ask you about, international and I shouldn't call it international because it's just got to the US, but from our perspective, right, international, other countries, everybody wanted me to ask you about timeline, Canada, Australia. But it was interesting to me because G6 just got reimbursement in Japan, right? So you're kind of doing a few things at once here. Can you speak? I mean, I know you're going to say to me with G7, we're going to roll it as soon as we possibly can. We know you want to be as many places as you can. My question is, how do you handle the overlap of still having G6 available, what you learned from going from G5 to G6 4 years ago, that kind of thing?
Yeah, it's a great question. We've learned, over time, every time we do a product launch, you learn more things about it. Also, the awareness and utilization of CGM around the globe has increased so much since 2018 when we launched G6. So we do anticipate that the rollout of G7 will be dramatically quite a bit faster than G6. I mean, G6, 3 years after the initial launch, we were still launching new countries with it. G7, it's intended to be much faster than that. And we do want to bring G7 to all of those markets. Part of it is a regulatory timeline. And then the other part of it is just access, kind of insurance and whatever the healthcare system is. That's part of also making sure we won't retire G6 in any geography until one, of course, the G7 is approved, and two, it has adequate reimbursement and coverage. We launched the first 5 countries outside the US. We've got our big US launch coming early next year, early 2023. And then we've got a couple of other big launches throughout 2023, and then a couple more in 24. But we do anticipate getting it rolled out much faster than we did with G6.
And it's a perfect segue talking about affordability and accessibility in the United States. Talk to me about pricing. I think there's some anticipation here that it's one piece, so it should be cheaper. What about insurers?
Yeah, absolutely. So the out-of-pocket costs for users, right, for G7 is intended to be very similar, basically the same as what G6 is. And that continues to improve all the time. We've got, the majority of our customers, pay less than $40 out of pocket per month. And, many, over a third of them actually pay nothing out of pocket. So G7 will be the same, but there is one of the things that happens when a product gets approved. You have to work with all the different payers, Medicare, insurance, private insurers to get the coverage. And so we've already, with the approval, the day you get approval, you can start doing that. And so we've been working on that, getting it set up. And now that we have the approval, we can go in and get some of that stuff finalized. We do also, with G7, intend to have some very accessible cash pay pricing in the time period where the coverage is still coming on, so that we can ensure that there's kind of seamless transition over to G7 from G6, so to help facilitate that transitions. But we do anticipate quite a bit of coverage to be there when we do launch, and then the stuff, those plans that are still moving on it, we have those cash pay options.
Again, this is a timeline question that I'd love for you to give me a date, but I doubt you will. Tandem, Omnipod, all your partners, this release will mean that their systems will work with G7. We know that. Timeline for that or planning for that, anything you can share? Right back to Jake answering that question. But first, hey, I am calling all moms. We've got a great new event just for moms of kids with diabetes. This is your chance to get away for a night, relax, and recharge, and learn about the latest and greatest in technology and support. Hey, Dexcom's going to be there. You can learn all about the G7 and ask your questions. So will Tandem and Omnipod and Abbott and Provention and Stay Put and on and on. We've got 2 amazing diabetes educators to answer your questions. Anna Sabino from Finding Smiles Coaching and Gary Shiner from Integrated Diabetes Services. He's the author of Think Like a Pancreas. Please go to diabetes-connections.com and look for Mom's Night Out. It is right at the top, the banner, to learn more. And guys, this would be an amazing gift. Give the gift of community and support and fun. We are planning the food and the cocktails right now. I am so excited about this. It's happening in January in Charlotte, North Carolina. If you're anywhere nearby, you gotta come. There is a hotel block as well. Stay the weekend. I can't wait. Now back to Jake Leach answering my question about compatibility. When will the G7 work with partners like Tandem and Omnipod?
Yeah, both of our partners, Insulet and Tandem, and a number of others, have all been working to integrate G7 actually for quite a while because the technology's been around. So they've been working diligently on it. I think their public comments are the best ones to rely on, but I do know that Tandem is saying somewhere around the middle of next year. So fairly shortly after we launch, they'll have that available upgrade from G6 to G7. Then Insulet's a little bit after that, but both groups we're supporting them with technical resources to help with the integration and ensuring that they can move as fast as possible.
Like I said, we have talked about this in the feature so many times. So I refer you as you watch or listen to go back to those other episodes, and I will link them up in all the show notes here. But Jake, back in May when we last spoke, you brought up the G8. I did not. You brought it up. I'm curious if you can share anything more, if not specific features, what your goals are with the next iteration of Dexcom.
Yeah, really what we're focused on for next generation CGM is very similar to what we've always, been after. With G7, it's a very large leap kind of in ease of use, as well as the performance of the product and the size, comfort. So next generation systems that we continue to focus on making the product as comfortable as possible to wear, extending the life of the sensors and the adhesive patches, and then also continuing to focus on the overall cost to manufacture the products as we continue to work through the cost of goods that it takes to manufacture a product. As we can reduce that, then we can reduce overall cost to the systems and basically expand the use of CGM globally. We've been doing that through all the different generations of products, and we're going to continue to do that.
Yeah, and it leads me to my next question, which is I was recently seeing that Ipsomed in Germany only, but has partnered with Libre to have an AID, a closed loop system there. Libre is not approved in the United States as an iCGM, so it's not something that's going to be coming here imminently. But I also spoke to the folks at OneDrop, and they're coming up with a CGM, more of a health sensor, but they are entering in the space. So how do you guys plan to compete in all of that? I always hear there's 35 sensors in the works right now. Is it going to be on accuracy, cost, working with these partners? You've kind of enjoyed a real space for a long time, as far as our perspective is in the T1 space.
Yeah, I think we'll continue to. I think it's really based on the connectivity of our systems. We've established a pretty strong ecosystem around our products, and it's because of the connectivity we offer, whether it's through Bluetooth direct to those pumps or it's through our APIs to our digital partners. And then when it comes down to it, one of the key important parts of a CGM when it comes to automated insulin delivery is the reliability and the performance of the sensor. And so I think we're going to continue to be the leaders there and drive it. G7 is the most accurate CGM available, and we'll continue to push that. We've been doing this for a couple of decades. Every generation, this being our seventh, gets better with both performance and reliability, and we're not taking the foot off the gas there.
All right, I have a couple of little questions here to throw at you at the end. My continual request for a more robust follow app. Any plans to let me flip that pediatric switch and see my kid's transmitter? Oh, it's not a transmitter number anymore. It's all in one piece. So could I? Well, you took care of that complaint. But so I could took care of that one for me. So I could see more information. Although my kid's almost an adult now, but you know what I mean, that the person following could see the complete information that is on the user's app.
Yes. Yeah. We've been, for the past year and a half, 2 years, we've been heads down on both G7 and our Dexcom One software products, with the global expansions. But with all the software capacity we've built up to be able to launch those two products at the same time, we will be turning those resources towards follow updates, continual updates to the G7 portfolio, as well as Dexcom One. So be on the lookout for more frequent software updates. And follow is definitely one of those that we see as a great product for users and something that we want to continue to innovate on.
And it wouldn't be an interview with me, Jake, if we didn't say, hey, direct to watch. So I know that the capability is in there for the G7,
in the hardware,
right? So talk a little bit about what it's going to take to get there, because people are really excited about that.
Yeah, absolutely. I've always found that to be a really both differentiating feature, but also a really convenient feature. And we definitely have built it into the hardware. So we've got the protocol for Bluetooth is capable. The one that's in G7 today is capable of supporting a third, display with a watch, direct to watch connectivity. And all it takes really now is it's on our roadmap for the G7 mobile apps. And so we basically, as soon as we are kind of getting through our rollouts, we're going to start working on getting that into the commercial product. We got plenty of prototypes running around, working in working fashion. And so it's part of the roadmap.
I don't know if you can share, but what is the holdup there? Is it that, frankly, this stuff is hard? Is it an FDA safety issue? Is it that it wasn't as, I don't want to call it not a priority. I mean, I'm curious if there's an answer to that.
Yeah, there is. It's quite complex when you think about it, because what happens is when you go direct to watch, for example, Apple Watch becomes your receiver. And so you know how important alerts and alarms are and the reliability of alerts and alarms. And so when we first kind of were given by Apple the connectivity directly through Bluetooth to the watch, we started developing, and we started to run into all of these types of challenges with ensuring that you had reliable alerts and alarms and display on the watch at all times, no matter what. And the watch was, not really initially, that whole platform was not designed by Apple to be, you basically take it off and you charge it and it's not doing anything. But if that happens to be your only receiver at the time, it has to have alerts and alarms while it's sitting there on the charger. So it's a totally different use case, I think, than was originally envisioned when the watch was developed. But the great news is that over the number of years we've been working with Apple to basically enable the type of functionality that's required for a CGM to be, for the watch to be the primary display. And so it's, the capability is now there. It was not that long ago that we kind of went through some of the last technical hurdles there. And so now it's cemented on the roadmap, and we'll get it out as soon as we can.
All right, last question. Anything about this launch in Europe or the testing of the G7 here in the States? Anything surprise you along the way? I mean, I know we always start with what we expect.
Yeah.
Anything come along the way that you were like, oh, I didn't realize that?
It wasn't a complete surprise because I'm a huge fan of G7 and it's, what is a huge launching point for us. But what is really exciting to see is that, more than half, over 60% of the folks that are coming on to G7 in Europe. So it's now unconstrained launch. Anybody, you can get in, and if you get the prescription, you can get in and get G7 in a number of countries. It's not a limited launch in any way. They're new to Dexcom. So over 60% are brand new users. They have not been a Dexcom customer before. So that's exciting because these are not just folks upgrading from G6. These are brand new customers. And so it reiterates the point around G7 being able to expand the market beyond the current base. And so we're really excited to see all of those new folks coming into the Dexcom family.
Well, Jake, thank you so much for spending some time with me answering all of my questions. I hope we talk again soon. I appreciate your accessibility, and I look forward to the US launch now that we've got the approval. Thanks so much.
Thanks, Stacey. It's a great pleasure to be here.
You're listening to Diabetes Connections with Stacey Sims.
Much more information. I know I didn't ask all the questions you sent in, but we've addressed a lot of those questions on previous episodes. So all of that is linked up in the show notes at diabetes-connections.com. If you're listening in a different podcast player like Spotify or CastBox or Overcast, a lot of those links will not work. So please head on back to the episode homepage. It's a lot easier to click through there. I also want to acknowledge, I mentioned Nerdabetic, and that is our friend Camille Armacki. He is so good. He has so many great videos. I really appreciate his information. And because he is in the UK, he's worn the G7 for a while. So if you haven't seen his stuff, I will link up to it. But he is Nerdabetic. All right, in just a second, I want to talk to you about something I'm doing differently in the new year for this podcast. And we're going to talk about the next couple of weeks and the schedule. But first, Diabetes Connections is brought to you by Dexcom. All right, so when we first started with Dexcom, it was December of 2013, as I mentioned at the beginning of the show. And you probably remember if you used it back then, but if you're new, the share and follow apps were not an option. They just hadn't come out yet. So when I say using share and follow apps make a big difference, trust me on that. I think it's really important, though, to talk to the person you're following or sharing with and get comfortable with how you want everyone to use the system. I mean, even if you're following your kid, these are great conversations to have. At what numbers will you text? How long will you wait to call? That sort of thing. And that way, the whole system gives everyone real peace of mind. I'll tell you what I absolutely love about Dexcom Share, and that is helping Benny with any issues using the data from the whole day and night, not just one moment like we had to before. Internet connectivity is required to access separate Dexcom Follow app. To learn more, go to diabetes-connections.com and click on the Dexcom logo. I want to take a minute and talk about the rest of this year. It's 2 more weeks, and also look ahead to 2023. So as this episode airs, it is December 13th. This Friday, the 16th, will be our last newscast episode of 2022. And I'll get back to the newscast episodes in a moment, but this Friday is going to be our last one. Unless something bananas happens and we get another FDA approval like this, I'll pop on. But right now, that's the plan. There will be regular Tuesday episodes on the 20th and 27th. So those are going to continue as normal. And then starting in January, we'll have January 3rd, Tuesday, the regular interview episode. Friday the 6th, we'll have a newscast. but I'm going to change up the newscast schedule, so that will only be every other Friday. The easiest way to keep track of all this is just to subscribe to Diabetes Connections, as most of you do. It's a free subscription, or I guess it's a follow now. It's called an Apple Podcasts. But whatever app you're using, it's a lot easier to just subscribe or follow the show. You can certainly check back to the website. You can also follow me on social media. But since I'm changing up the schedule, if you haven't already, just go ahead and follow it. It automatically comes to you. Little behind the scenes on this thinking, the newscast is extremely popular. I'm really thrilled about this. It's actually more popular than the long format episodes, specifically with healthcare providers, which is very cool, and I get great feedback from them. But my schedule is such that I am not able to give it the attention I want to, and I want to make sure that it's good, right? It's quality. I'm a one-man band over here. I know I have my fabulous editor, John, but in terms of production and guest booking and everything else, it's just me. So I'm doing the best I can, and I want to make sure I give you guys a quality product and episode every week. Look for some more changes. As always, at the end of the year, I always consider some changes for the year to come. And I always will ask in the Facebook group for your suggestions. So please look for that as well. All right. Thanks, as always, to my editor, to John Buchanan from Audio Editing Solutions. Thank you so much for listening. I'm Stacey Sims. I'll see you back here in just a couple of days. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.